Good evening. My name's Eric, and I'm from Jesse Brown VA Medical Center, and you're watching Veterans Issues, brought to you by CAN TV 21. And today we have a very special guest. One of our ER physicians, Dr. Tulika Singh, is going to be talking about battlefield acupuncture over the next 25 minutes. So this is a live call-in program. Call in with your questions. We're talking about how battlefield acupuncture can be used to help with a variety of pain management concerns among our veterans. And you can reach us at 312-738-1060. So Dr. Singh, thank you for coming on the show and sharing your expertise with us today. But why don't we start back up a little bit and tell us a little bit about who you are and what your role is at Jesse Brown VA Medical Center.
Sure. Thank you for having me here. This is awesome. So I am I'm an ER doctor. I work at Jesse Brown VA, and I've been there for it's just a little over 6 years now. So
Only 6 years?
6 years, yes. I was in the community
Were you at Jesse Brown when I met you? 10 years?
No.
No? Okay.
No, maybe
Okay.
just
Just
after.
Okay.
Or,
Okay.
no, a year after. No, just after. Anyways.
Oops.
Moving on. So that's one of the hats I wear, and a really important one to me. I'm also a national education champion for whole health with the Office of Patient-Centered Care, and I'm a board-certified integrative medicine physician.
Awesome.
Yeah.
So we've had a lot of, we've been featuring whole health on the show, and we've had a lot of different people talking about the different complementary and alternative medicine approaches, and the whole health approach in general that kind of features kind of what's important to the veteran, implementing self-care strategies, and then pathways through which providers use their expertise in alternative medicine. So I guess battlefield acupuncture is one of those routes.
That's right. That's right.
And so what is the role of what is battlefield acupuncture?
Sure.
Why don't we start off with that?
Yeah, okay.
Like, what's the difference between battlefield acupuncture and Chinese medicine acupuncture?
Mm-hmm. So acupuncture, everybo's heard of acupuncture now. It's in almost mainstream, almost. It's been around for over 5,000 years, in traditional Chinese medicine. It's slowly making its way into the Western kind of biomedical model, but really and we do have acupuncture at Jesse Brown, traditional medical acupuncture, yes.
Yes.
Battlefield acupuncture is actually a specialized design protocol. It's a protocol that was made by a U.S. Air Force doc, Dr. Richard Nematow, back in 2001, when he was active duty and he was actually treating injured military personnel with this technique, especially when pain medications weren't advisable. And so he used the ear, both ears, as and specific points on each ear, as a way to control pain prior to transport to the hospital or whatever. And he found that it was very effective, and now we've been using it at the DoD and VAs all over the country.
Wow.
And about a year and a half now, we've been using it at the emergency room at Jesse Brown.
Well, so someone, a vet comes into the emergency room with a pain condition, and you offer battlefield acupuncture to manage the pain.
It depends. You can't offer it for every kind of pain, but there is a very long list of conditions that you can use it for. So usually chronic or you need to have a medical diagnosis for the pain before you can treat it with battlefield acupuncture. So you don't want someone coming in with an acute abdominal pain you don't know what it's because of, or back pain that has red flag symptoms, right? So lower extremity weakness, or other signs that something might be happening that's dangerous. If that's not the case, especially if you've had stable, unchanging pain for 6 months or longer, usually that's safe. Chronic pain, acute on chronic pain. But also other things, for example, acute ankle injuries or neck strains. You can use it for migraine headaches, primary headaches.
Really?
Again, knowing the cause, knowing that there are no red flag symptoms or signs, you can use traditional, or you can use battlefield acupuncture.
Wow, that's really interesting. For those of you that may have just joined us, we're watching Veterans Issues, and we have Dr. Singh from Jesse Brown VA Medical Center talking about battlefield acupuncture. So, that's interesting, and I understand now because I was, there was a big opioid epidemic in our country, and I saw some article talking about kind of battlefield acupuncture because it becomes an alternative to opiates that are much dangerous and can do, the acupuncture can do the job just as well. So, are there any side effects?
For battlefield acupuncture?
For battlefield acupuncture?
So
some redness and swelling, maybe?
Yeah.
Maybe, possibly.
Possibly. So, I mean, they're needles. So we use disposable, sterile, one-time use needles. They are semi-permanent in the sense that they are not like traditional acupuncture where you put the needle in, wait 30 minutes, and take them out. These are put in and you go home with them. They fall out by themselves in 2 to 4 days, within a week.
Wow. What is their... How big are they?
Tiny.
They're tiny.
They're tiny. There are a couple of different types you can use. One looks like little studs on the outside. One looks like, they look like the little Band-Aids that you use, those little round Band-Aids. That's how they look. They're little tiny, like almost like ear tacks.
Okay.
So whenever you think of needles, you think of bleeding, you think of infection, inflammation, some discomfort sometimes when putting it in. But these are pretty minimal, and they're very easy to take off. So if there is any signs of inflammation, we usually advise the veteran to just pull, take the needle out, or you can take the sticker out.
Great. Well, it looks like we have a caller already.
Oh, okay.
So let's hear from our caller. Hello, caller. You're watching Veterans Issues with Dr. Singh and Eric Prosher from Jesse Brown VA Medical Center.
Hi, good evening. My name is Steve. I'm in Schaumburg, and I just wanted to ask you a question. I looked up an article that talked about a training program that had trained over 2,800 providers in battlefield acupuncture. It was over a 3-year period, and different organizations like the U.S. Department of Defense and some others trained everyone. And I was curious what your take might be if you feel that there might be some more training that's needed, and if there's follow-up for these 2,800 people. I'm sure that there's lifelong learning, but I'm curious what you might have to say about more teaching.
Thank you, Steve. That's a good question, because I was also interested in what are the qualifications and training to become a battlefield acupuncturist. So it sounds like, Steve, that you were interested in what that training was like for the 2,800 people, and if they need to do continuing educations to stay current in the field in that area?
Absolutely. That's exactly what I was looking for.
Okay.
Yeah, that's a great question. When you look at traditional acupuncture, that has a lot more hours of training. For battlefield acupuncture, the certification takes 4 hours. In which there is didactics, there's demonstrations, and then we have practical. We actually practice on volunteers. And then after that, I know for myself, I have to there is continuing monitoring my practice. So I have someone overseeing me to make sure that they come and observe me doing it, and then they also look at my charts and make sure that I'm actually doing it properly. So they look at about 10 patients, 10 random charts they pull for every 3 months or so. So
wow.
It's a fairly simple technique. I'm going to demonstrate it in a little bit. So it's a fairly simple technique. It's not as complicated as, say, traditional acupuncture or medical acupuncture. But still, I think it is definitely the right thing to kind of keep the keep the observation and training ongoing.
Do you do traditional acupuncture as well?
I don't.
It's just battlefield
Just
acupuncture.
battlefield acupuncture.
And is battlefield acupuncture, maybe you alluded to it, is it just a one-time thing, or is it something that you would come back for, and how long are the effects? How long does it
Right,
last?
that's a great question. So battlefield acupuncture, it is something that oftentimes has immediate effect. We can't really tell which person will have a good effect and which person will not. We know that data suggests about 80% of the time there is some reduction of
I
pain.
heard about that.
And oftentimes this is long-lasting, with weeks or days to weeks, much longer than a pain pill or pain medication. And if it is repeated, and oftentimes, and I'll just touch on that in a minute, but if it is repeated, the effect is actually longer lasting each time.
Oh.
So various VAs have BFA or battlefield acupuncture clinics where they have patients come back every week for, say, 6 weeks, and then every month for 6 months, and kind of see if there's an effect and see how long it lasts. We are in the process at Jesse Brown to start a BFA clinic, hopefully also in the C box too. But that's a process that's still underway.
Great. So for those of you who just joined us, we're talking with Dr. Singh, and we're talking about battlefield acupuncture at Jesse Brown VA Medical Center, which we're located on 820 South Damon Avenue, but there's also C-Box that are located in northern Indiana, Auburn Gresham, Chicago Heights, and then also in Lakeside. So here's some of the other clinics that we hope to have get the stuff up and running. So now going back to the training piece, is this something that only a physician can administer? What are the credentials of people to be qualified for the training?
Actually, so no, it's not just physicians. Nurses, nurse practitioners, PAs. So it's a wide range.
Okay.
Actually, it definitely depends on your individual state licensure and what is the scope of practice for that. But in general, it's not just physicians for sure.
Okay. I don't want to go too deep in the weeds, but I was just curious about the mechanism of action for the battlefield acupuncture.
Yeah, I mean that's
I took a
that's
Chinese
good question.
medicine. I audited 3 Chinese medicine courses when I was in graduate school.
Yeah.
Sorry. And I remember in those classes, like
Yeah.
in Chinese medicine, everything's like yin yang. Qualities and even the body organs, and they have this kind of holographic principle is what they talked about as being like each body part represents the whole, and that's kind of some of the principles
That's
of
right.
acupuncture are connected to these
Yeah.
type of things.
I find it really fascinating, this battlefield acupuncture and why it works. I think it is, they're learning more and more, they're researching more and more and trying to really figure out why it works. There's a few theories supported by scientific evidence. One is, the actual needle itself it releases local chemicals that has a healing effect on the tissues. That's one. It also, it acts in 2 different ways. One is it affects the pathways through the spinal cord. The nerves going through the spinal cords, and it also has kind of a separate effect through the neurotransmitters in the brain, like endorphins.
Yeah.
And functional MRI really demonstrates this, and it's just fascinating that you can think that the entire body can be mapped on the ear, and the body and the functions, and that these points can correlate, and the local effects can affect distant organs. It's fascinating to me, but a lot more research is being done and trying to really narrow it down.
Right. Great. All right. So is there anything else we should know about battlefield acupuncture before we do the
So
demonstration?
yeah, I would say that couple people there's a couple of contraindications.
Contraindications. Yes.
So
glad you
pregnant
thought that.
patients, and the reason why, because I was always like, why can't I use it on a pregnant patient who has
Yeah.
nausea, vomiting? The points, there are certain points that are very close to the point that could cause premature or
Birth or
yeah, uterine contractions. So you don't want to use battlefield acupuncture. You'd rather go the traditional acupuncture route to
Okay.
avoid those points.
yeah. Wow.
Anybody who has a needle phobia or who
Yeah.
has had a vasovagal, fainting response to
needles.
needles might not be a good candidate.
When
then
I was in
also-
the Navy, you'd see them, people pass out
Yeah,
just like
yeah.
taking the needle out. Yeah. Well,
Yeah.
you're in the ER, you probably see it more than I did.
Sometimes. Sometimes. All right.
All right. So,
Should we demonstrate?
sure.
Okay. So I'm going to use these. This is what I've been using a lot. So there's two types. I'll show you. There's more than two types, but this is the Asp Gold Needles. So they look like
Here, we'll zoom in.
they look like
Okay.
that.
All right.
So it's hard to demonstrate without actually putting it in, but it has a little barb. Oh, maybe you can't see. Can you see the barb?
Yeah.
There's a little barb that goes in. It's tiny. It's
Okay.
like a millimeter.
Yeah.
And that goes into the ear, and then there you go. There it is. Can you see it? It's tiny.
Tiny.
Ooh.
Okay.
Okay, so that's one kind. A little more painful going in, and I find that veterans, when they come to the ER, they might not appreciate that so much. So this is a second type, and I won't open it all the way because this is the one I'll use on you. And I've been using this more. So it looks like this is a packet it comes in.
Okay.
And the outside, once it's in, it looks like this. Looks like a Band-Aid.
Oh, yeah.
Yeah. Can you guys see that? Yeah.
Oh,
And
let's see
then
if it's,
it's kind of bright.
yeah.
Oh yeah, there's.
There we go.
So it looks like a little Band-Aid. And the needle's on the inside of that Band-Aid and just like in the center of that.
Okay.
And that's just pressed in. So usually when someone comes in, I'll clean their ear off with some alcohol. I'll wear gloves. These are sterile one-time use needles. And it literally takes me 3 minutes maybe. Sometimes it takes longer to start an IV and get medications. And 3 minutes. Sometimes I'll do kind of a mind-body practice with it, maybe a little bit, but oftentimes not. We'll traditionally, after each needle, you're supposed to walk the patient to kind of get the circulation going and get those local chemicals kind of distributed. But in the ER, I find that someone who comes in with severe pain, it's hard to get them up after every needle.
Yeah.
So I modify it a little bit. But
Okay.
so I'm going to get some gloves on. We are going to use Eric's ear,
My ears.
your ears. Come on now.
They used to be pretty at one point, but with
Nobody
age,
will mind.
the ears just get gross as the older you get. Have you noticed that? Oh,
Yeah.
yeah.
It is what it is.
Yeah.
All right, so there are 5 points on each ear, and they're, I don't know, can they see this? Can you zoom to this picture? I don't know.
Yes. I mean,
It's kind of small, but those are the points.
points
and,
of the ear. Okay.
and I'll point them out as I'm putting them in Eric's ear, but I'll start with this one here. It's called the cingulate gyrus. Then I'll go to the thalamus, which is here.
Cingulate gyrus, that's a very important spot in the brain.
And then this one's the omega-2. Point 0 is right in the middle there, and that's Shenmen. And Shenmen, I like Shenmen because it helps kind of anxiety and stress. And I find that everybody can use some Shenmen.
Yes.
All right, okay.
Sounds cool too. All right.
Okay,
So, should I just put my ear down like this?
yes.
Is that my
That's
good
okay.
placement? Let me see.
So I'm just going to clean your ear off with some alcohol. Okay. And then
It's burning. No,
Oh,
I'm just
no.
kidding.
All right, so I don't know if everybody can see the little needle. I'm just going to put in the first point. I'll just hold pressure for 5 or 6 counts. Now, usually we alternate points on each ear, so I'd go this point in the right ear, left ear, same point, and then back and forth. But just for the purpose of this, we're just going to apply. So you can see it where it is now. That's the first point, right there. Okay. Does it hurt?
No,
Can you feel it?
barely. No.
This can't be good for your sciatica.
Maybe hold me over. I'm waiting to get
The other side.
an epidural.
Oh, really?
Yeah.
Oh, I meant the
The
position.
No, I know.
Well, we'll get your other ear when we're done here.
Well, no electric shooting pains. I think
Okay, that's good.
it happens random though. Forward folds is one of the triggers.
Oh, really? Great. We should have had. Okay, and last one.
So I'm not feeling anything. It just feels like a light pressure, but afterwards I'm not feeling any prick or any. It doesn't even feel like the surface of my skin has been violated. Did you push it in deep enough?
I think so. Okay, you can go ahead and get up slowly.
Okay. Ooh.
Are you feeling lightheaded?
A little bit, but maybe that's just from
The position
going
you were in?
down from up.
Yeah, yeah. Some people can get almost like a euphoric feeling after the procedure. You doing okay?
I got a old neck and shoulder.
Crick in the neck? Okay. Well, so that's a procedure. I mean, that would, again, we would alternate right, left, right, left, right, left.
Okay.
For the 5, then I'd have you walk around the room just a little bit
All right.
to see how that would feel, and then we'd see how your pain level, we would ask
you
what
rate
your
it
pain
before and
level was
afters?
before and after. Yep.
Okay.
Exactly. Yeah.
Cool.
We've been seeing some good results in the ER.
Good results?
Yep.
So how long? It's been about a year? Oh, we have 1 minute left.
About a year and a half.
Year and a half. That's so awesome. So thank you for taking your time to come in and share us and demonstrate on us. For you, those that are interested in battlefield acupuncture, what are some next steps for follow-up at the VA? Well, if they're in acute pain, they can come to the ER.
Come to the ER. There's several of us trained now.
Okay.
Several of us trained at the VA in the ER. I think there are people who are getting trained in their whole health has, or the Office of Patient-Centered Care, their whole health for pain and suffering course has a battlefield acupuncture training attached to it.
And look, we'll have some more information on our Facebook page. So check out www.facebook.com/VA Chicago. Okay? And so my name's Eric Prosher. This is Dr. Tulika Singh. And we represent Jesse Brown VA Medical Center. We like to thank you for watching CAN TV 21. And you can, again, tune in next month, 4th Thursday of the month. We'll be here again. But over the next 5 minutes, Fathers Who Care will be on, so stay tuned for them. I would be remiss if you need to talk with someone 24 hours, 7 days a week. We have the crisis line, the VA crisis line, and you just dial 1-800-273-TALK and press 1 if you're a veteran. All right. Thank you, and goodbye for now.
Bye-bye.